mastoid muscle. So if you remember where that muscle is from A&P1, there's that muscle, mastoid. There's a sterno, there's a cleido part. But here's that external jugular vein running right on top of it there. Usually easier to find if you've got some reference point. See your facial artery going there, along with the facial vein coming across. Superficial temporal vessels, superficial temporal artery, superficial temporal vein. And there's your occipital vessels here in the back, occipital artery and occipital vein. So that's all anatomical terms and a little bit of knowing where your sternocleidomastoid is for reference.
Are these the temporal ones or these?
These, right along the side. Don't worry about these. Y'all don't have to do all these other little branches. But superficial temporal artery and vein, gonna be right along the side. Just like that. The way that the external jugulars work. Remember I told you earlier, a lot of times if you know the name of the vein, you also, or rather the artery, you also know the name of the vein. Here are the subclavian arteries, right? This is also the subclavian vein. The subclavian vein eventually merges with the external jugular. And when they merge together, they form brachiocephalic veins. This is why it is important to indicate artery or vein. If you told me brachiocephalic, do you mean artery or vein? Because there's also brachiocephalic veins. So I need to know. You got to indicate. You also need to do left and right. This is a left brachiocephalic vein, very short little piece right here. Once again, formed by the merger of the external jugular with the left subclavian vein. And over here we got the right external jugular merging with the right subclavian vein to form a very, very short right brachiocephalic vein. So you have brachiocephalic veins and also a brachiocephalic trunk, a brachiocephalic artery. Like I said, this is why it becomes important to tell me left versus right, artery versus vein, because I need to know what vessel are you looking at. All right? All three of those are different. If you just wrote brachiocephalic, there's three things. And I don't know which one you mean unless you tell. All right, so that's a little bit about the head and neck. So you start of the abdominal aorta. This section is called the abdominal aorta. Didn't tell you, but the aorta loops off. It continues as a descending aorta, so it's a short segment. It's a descending aorta about to the sixth rib. And then from there down, it's the thoracic aorta. Not a lot really comes off the thoracic aorta. There's some vessels that supply the muscle in between your ribs. They're called intercostal arteries. They're not even on this model, though. But continue on down here. Once you pass the diaphragm, you have the abdominal aorta. Multiple branches. Like I said, we'll deal with those next time around. At the bottom of the abdominal aorta, notice the aorta splits kind of like a wishbone. And what happens is it gives rise to two common iliac arteries. The name based upon which side they're on. You got a left common and a right common iliac. Similar pattern to what you heard me mention a few moments ago. You got common carotid arteries that branch to give you internal and external carotids. You're going to see that same pattern. There's going to be an internal iliac artery and also an external iliac artery. So we'll follow it on the left side because it's a little bit cleaner over there, a little bit less stuff going on, and plus I need to show you some other things on its left side. So as you follow the common iliac, notice right at my finger there, see there's a split. One split continues to go outside, and this one dives into the pelvis. This is the internal iliac artery. The left internal iliac goes into the pelvis. And here's the left external iliac. The external iliac is what's going to give rise to the vessels throughout the lower extremity. External because it's going to go outside the pelvis, so to speak. Follow that external. It crosses over this inguinal area here where the hip would be. Once it crosses through, we now have a femoral. This is femoral artery here. This is the femur. Notice how this vessel is a little bit closer. This is that deep femoral artery. It's still in the femoral area, it's just deeper. This would be the surface, this would be more superficial. So here we have femoral, which is superficial, and then deep femoral, which is deeper, closer to the bone. The femoral artery continues to run inferiorly toward the knee. Here, there's the patella, if you can see that triangular shaped bone. So the patella is in the front of the knee. So we're at the back of the knee, right? Popliteal artery here. The popliteal continues. See how this wide, broad top margin, that's the tibia, all right? So this is posterior tibial, and notice it throws a branch off that kind of curves around. Here's the anterior tibial. Posterior and anterior tibial arteries. This would also be, notice the difference in the orientation of the legs here. One is turned to the side, one is in anatomical position. So this branch and this branch are the same. It's just that this one you're seeing from the anterior view, and this one you're getting more of a lateral view of it, okay? This is anterior tibial, this is anterior tibial. And then usually we identify this small little branch right here along the medial aspect of the foot. It's called a dorsalis pedis artery. One of the arteries used in some cases to try and detect a pulse. If you ever heard of pedal pulses, usually all we do with those is try to check circulation. If you get a pulse at this point in the foot, it means that blood's flowing through all the vessels up above it. Don't really check pulse rates with it. Like I said, we just check perfusion to see if the blood's moving through. So, got some of the arteries there throughout the lower extremity. You got a femoral artery here. I'm sorry, femoral vein, excuse me, on this side. This vein, though, running along the medial aspect of the leg, this long one, that's called a great saphenous vein. You may see that in the handout as well, but this is a great saphenous vein here. It's medial, it's long, it's really long. You hear about coronary artery bypass grafts or heart bypass surgery. What they usually do is take part of this vein, they harvest it, because we have the saying in anatomy, blood finds a way to get back to the heart. If you take out a vein, blood usually has another route to go. Arteries, not so much the case, but veins, yeah. Veins, they're kind of dispensable. Not completely, but kind of. Anyway, they take pieces of this great saphenous vein, they move them up here around the heart, and they use it to create bypasses through around blocked arteries around the heart. So that's what usually that whole situation with the bypass grafts is about. But femoral vein, great saphenous vein. A couple of veins. You got internal, external iliacs run with the internal, external iliac arteries. Common iliac vein runs with the common iliac artery. So, like I said, if you know the name of the vein, in many cases, the artery, you also know the name of the vein in most cases. All right.